So we will go for obstetric ultrasound. I know this will be the personal favorite of many of you. Most of you will go and opt this gynecology. Don't kill me. Those people are going to take gynecology, okay? And every one of you will be interested in seeing the baby movements and all those things, okay? Actually, this OG part was very frightening for me, because whenever I was called for any emergency OG cases, actually I was more stressed out than the patients, because the OG consultants will shout like anything. Sometimes I may be in the canteen drinking some tea. They will immediately call. I will go after 10 minutes. They will shout like anything. Aha, where are you? Aha, like that. It's frightening. I will tell the stories. Okay, one by one I will store. First, the simple parts I will tell. When complicated things, I will tell later. Okay, so OG is always a headache for radiologists, because if you miss an anomaly, you will land up in what? Criminal case. You will have to give hefty compensation. Actually, I stopped doing OG ultrasound now. I'm not doing. I'm basically into CT and MRI. That is my strong zone. Like, okay, so everything is there, and the fights with physicians is another headache. I know most of you will take OG. Don't kill me, okay? I'm simply telling. Okay, so the thing. So first, starting to obstetric ultrasound, when you are getting married and your spouse or yourself is getting UPT positive, what will be the first step that you do? What will be the first thing that you do? Some of you have kids, so you know what is the next step. You are UPT positive, you are going to gynecologist, then what is the next step? Yeah, they will send you for a dating scan. So this is the dating scan. Okay, so what is the purpose of dating scan is, you have to confirm one, whether the pregnancy is intrauterine or extrauterine. That is the first thing. And second thing is, it is a single pregnancy or a multiple pregnancy. So these are the things that you have to understand, okay? Whether it is a single pregnancy or a multiple pregnancy. Actually, the topics that I am going to discuss for the next 20 minutes or 25 minutes will be completely related to gynecology and very, very high yielding topics, okay? Definitely you will get a question, so you have to be very, very careful. It is not like the thyroid or orbit, which rarely they ask, but these things definitely they ask, okay? So first, radiological sign of pregnancy is seen by 4 to 4, actually saying it is 4.5 weeks, okay, perfectly. If I say it is 4.5 weeks, so what is the finding? What is the finding that you are seeing here? Any idea? Just give short forms, it will be okay. What is the finding that you are seeing in first image? Any idea? So this is the gestational sac. You are seeing the gestational sac. So this is the gestational sac, okay. So you are seeing the gestational sac in which part of the uterus? Whether it is in the endometrium or myometrium or any other metrium. Yeah. So this is the myometrium and this is the endometrium. So the endometrial cavity is enlarged, and so you are seeing a gestational sac. So the first part is, you have to understand this is a gestational sac within the endometrial cavity. This is the that is the first point. First question. So if you are doing it by 5 to 5.5 weeks, between 5 to 6 weeks, within this gestational sac, the sac will become larger. You will be able to see the yolk sac. So this is the yolk sac. Okay, you will be able to see the yolk sac. So by 5.5 weeks, you will be able to see the yolk sac. And later, by 6 weeks, if you do, this is the this is the gestational sac. This is the yolk sac. And what is this yellow arrow? Any idea? What is this yellow arrow? So 6 weeks you will be able to see the gestational sac. Inside that there is a yolk sac, and attached to the yolk sac, just like a signet ring, allantois. Okay, any other thing? Actually, I don't call it as allantois. I call it as embryo. You will be able to see the embryo. By 6 weeks, you should be able to see the embryo. So you should know this chronological order. And finally, surround the embryo, there will be another sac. What is the name of that another sac? So this is the gestational sac. This is the yolk sac. This is the embryo. And surrounding the embryo, there is another sac. What is that? That is the amnion. Okay, that is amnion. So when two bubbles are there, that is called as the double bleb sign, which is seen by 7 weeks. And by 7 weeks, you will be able to see the fetal heart also, FH also. By 7 weeks, you will be able to see the fetal heart also. So, by 4 to 4 and first, you will be able to see the gestational sac in the endometrial cavity. Then by 5.5 weeks, you will be able to see the yolk sac within the gestational sac. Then embryo will come. After that, amnion will come. Okay. So, when there is yolk sac and amnion, that is called as the double bleb sign. Is this clear? Very, very important, because in from obstetric side, you can expect 20 to 25 questions, and both this together combined is actually you can expect more. So that is why. Is this clear? Should I move forward or shall I repeat again? Okay, this is clear. So when will you tell that the pregnancy is viable is when you see the fetal heart rate, you can tell that the fetus is viable. So when you will tell the patient is having a failed intrauterine gestation or IUD, intrauterine fetal demise, is when the gestational sac is more than 25 mm, but there is no yolk sac, means the pregnancy has failed. When CRL is more than 7 mm and no cardiac activity, that also means the gestation is failed. So my question is, what is CRL? What is CRL? That is my question. Any idea what is CRL? Yeah, it is the crown rump length. It is the length between the head of the baby and the buttocks of the baby. It is the length between the head of the baby and the buttocks of the baby. This is called as the crown rump length, CRL. This is the crown rump length. Okay. So when the CRL is more than 7 mm, just remember these 2 points. That is very, very important. It is called as failed intrauterine gestation.